got to a point where sometimes some blood would come out. If an operation was done here, it means my throat would have been messed up, but the problem would not have been solved. I remember in one of the clinics that I went here, and I tried asking the doctor some questions, and he was like, he gave me a face of, you guy, I have too many patients waiting there. Can you, hurry up? I need to go to the next one. Keep your medical reports, because in future, that helps any other doctor who's going to, see you, to see your medical history.
Hello there and welcome to yet another episode of Kaleke's Health Moments. We live healthy one story at a time. Today our topic is about misdiagnosis, and we have someone who is going to share his experience. Jimmy Gate is a Kenyan gospel artist and entrepreneur. He rose to fame with his hit songs Muhadhara and Huratite. Since then, he's been churning out hit song after hit song. In 2019, doctors told him that he had to undergo a throat operation that would have stolen his voice because his case was a misdiagnosis. He shares his story. In a nutshell, you can tell us your name, your designations, and tell us when you visited local doctors, why you did so for the first time here.
My name is James Mutheremu, but a lot of people know me as Jimmy Gate. I'm not only a musician, a gospel musician, but I'm also an entrepreneur. I'm a businessman. And the reason I was going to India was because I had, a condition on my throat, and I think a lot of people know about it because I made it public. And I was going there for further treatment because I was told that I needed surgery on my throat. But considering that my throat is very, very vital for me, I decided if indeed I needed surgery, then I would, get it from the best hospital. And that had to be in India because India is probably number one when it comes to health issues in the world. Health services in India are very, very well advanced. So,
prior to going to India, one would say we also have hospitals in Kenya. Did you bypass or did you pass by any? Yeah, and you can briefly tell us your experience.
Yeah, there are many hospitals in Kenya, good ones. However, sometimes I think because of the technology level, some of these hospitals are not able to pick some of the conditions properly. And that's why we have a whole lot of people who've been referred to India because there they are way more advanced. By the time I was going to India, I had gone to all these big hospitals without mentioning their names. And I had gotten opinions from all of these hospitals, and I was told that I needed surgery. So by the time I was going to India, it was like my last resort from here.
What effect did that have on you? The effect of your condition physically, socially, economically?
Well, of course, going to different hospitals and not getting the solution I was looking for was quite frustrating because the problem kept disturbing me. My throat is very vital for me. So when I start feeling pains and it got to a point where sometimes some blood would come out, it wasn't comfortable. I was very scared. So it was draining for me physically, emotionally. I would even say spiritually. It was draining for me. Financially, of course, I had spent a lot of money in all these hospitals and time. So I wouldn't say it was a good place to be at.
Can you tell us about India? What's different about the treatment here and the treatment in India? Anybody who is a stakeholder watching can see what they can take from an experience of somebody who's been there.
Of course, the difference is there. I mean, this is India. India is way advanced more than our country. But here's the thing, we are a third world country. And we are still developing. So having that in mind also helps us to put some things in proper perspective. So I don't like criticizing our country because we are still at a level where we honestly can't get all the things right. You know, our level dictates that we are still experiencing some problems. Even musically speaking, I mean, if you look at Nigeria, if you look at South Africa, if you look at Tanzania, they are way ahead of us. If you look at the US again, if you look at the UK and all these developed countries, the way they do their music is way advanced. So it's the same thing, even when it comes to the health sector. I mean, we are talking about the same things. So our hospitals here may not be at a level where they have all these high-tech, technologies that some of these hospitals are using. However, in terms of, the differences, I would say, I think it has to do with attitude. Most of the hospitals here, and I'm not saying all the hospitals, I mean, they are good hospitals here, but a whole lot of them are in it for the money. They are not out there to help people, and that's why the other day I actually saw a press that was talking about how, I don't want to mention the hospital, how a doctor would, keep a patient in the hospital to meet their target financially. They have a target. They're told this month you need to make X amount of money, and so they ask themselves, so how do we make the money? By charging patients more, or keeping patients more, or treating a patient for a condition that doesn't even exist. And because the patient doesn't know, the doctor seems to know, and the patient would trust the doctor more. Whatever the doctor says goes. So if the doctor says you have to be here for a couple of more days, the patient would be okay with that because now the doctor has said anyway. So I think the attitude is, to me, a major difference. When I went there, they don't even want me to spend in the hospital. To them, the only reason you're supposed to be in the hospital is if your condition does not allow you to be out there. They want to treat you and send you home. And I'm not saying again that happens in every hospital in India. I mean, we are in the world. We are not in a perfect world. I mean, even the way they talk to you, they give you time. The doctor makes sure that you're clear on what he is doing. You ask him questions, and if you don't understand a procedure, he'll explain to you. He's patient with you. He's not in a rush to get to the next patient. I remember in one of the clinics that I went here, and I tried asking the doctor some questions, and he was like, he gave me a face of, you guy, I have too many patients waiting there. Can you, hurry up? I need to go to the next one. But one of the differences I saw is that there the doctor gave me enough time to understand what was going on with my body. He would explain to me with diagrams. He would, and the tone of his voice is so soothing. It's so comforting, and you feel like this is somebody who cares about me. And then the other thing is, of course, the doctor doesn't just see you as him alone. There are so many doctors who are handling your case, and they're discussing your case. And like here, most of the patients will be seen by only one doctor, and he's seeing so many other patients. But there I realized, I think I had like 4 doctors, and these are top throat doctors, When the throat doctors could not figure out my problem, I was taken to a gastrologist, to check my tummy and all that, and they did all the tests.
I've had when patients travel to India, there is a pool of doctors from
Right.
all sectors,
Yes.
like a nutritionist, somebody for mental health,
Yeah.
which might be missing here. At least if it could be adapted here, it could be a good thing.
When I was coming from here, my throat was supposed to be operated on. Going there, and they did all these tests because they are using a pool of doctors, they realized this guy doesn't even have a problem on his throat. It's coming from his stomach. See, if an operation was done here, it means my throat would have been messed up, but the problem would not have been solved. So that was a major difference for me. Of course, another difference is the cost of treatment. How much I spent there is probably a quarter of what I would have spent by being treated here. The amount of money I was being asked to pay here in one of the hospitals that I won't mention for the surgery, and remember the surgery would have messed me up, but I would have paid 4 times more what I ended up paying in India. You know, and I'm not advocating for every patient to go to India, but I mean that's the reality. So many patients are going to India not because hospitals are not good here. I think it has to do with attitude. The attitude of our medical officials. Most of them. Again, I don't want to generalize and say that this is, you know, a general feel of how all the medical practitioners are, but a very good number of them don't have the right attitude towards patients.
What about record keeping? Were you given all your files and documents?
That's a good question. The files and, you know, the records. I have all my hospital records from the first day I went there. Every procedure, every payment, every test that I was done. You were given a big, you know, pocket envelope that contains all your, you know, medical reports. I have them with me. So it's your right to get all your medical reports. Why? Because if you visit another hospital, then you're able to present those reports and the doctor can see your history. And most patients here don't usually get the reports. They will probably get later on. But then again, I think it has to do with our education. We are not taught that you need to go home with your medical reports. So I think it has now been established as a culture that when you go to the hospital, the medical reports belong to the doctor. Yet patients don't know that it's your right to actually have your medical reports. So if you're there and you're going to the hospital, always ask for your medical reports. They can make copies for you. But sometimes they will not unless you ask for them. It's your right to have your medical reports. You know, I deal with a lot of patients who go to India, and a whole lot of them come and, you know, they don't even have all the medical reports, or they have to call the doctors and the doctors are telling them, oh, we don't have your medical reports, oh, we can't find them, oh, you know, all these sort of reasons, you know, are given out. But I want to encourage every patient out there who's watching to make sure that you keep your medical reports, because in future that helps any other doctor who's going to, you know, see you, to see your medical history.
Tell us, after you whatever you went through, did you meet other Kenyans in India, and how are they faring, and why were they there?
Well, that's a good question. So when I went to India, first of all, the hospital I was in, we were probably over and above 100 Kenyans, which is a significant number. In fact, I remember meeting Kenyans in a hotel, and we were doing a meeting there, and we were so many. Some of the sentiments I picked were that, you know, there were a lot of misdiagnosed cases. Mine was one of them. And so when I was sharing that with some of the patients, they talked to me about the same thing. They say how many of them were misdiagnosed, and that is part of the reason why their conditions had deteriorated to a point where they needed to go to India for treatment. So misdiagnosis was a major reason why they were there. Others, of course, was because they trusted India more, because India has a name when it comes to medical treatment.
Tourism, yeah,
medical tourism is really huge there.
Mm.
So there's more trust there.
Mm.
Others were because they were referred by their Kenyan doctors, and they were told, we can't handle this condition anymore.
Mm.
You need to travel to India for a better opinion or for treatment. So those were some of the reasons. Others were there because they were stuck. They didn't have enough money, and realizing later is because there are those brokers from here who will say they have hospitals that they work with, and when patients want to go to India, they can direct them there. And so they misinform them. They get them opinions that are not credible. So for argument's sake, a patient will come out of here knowing that they are paying 1 million shillings, only to get there and they are told they have to pay like 2 million shillings. And they had already, fundraised and raised probably 1 million or 1.2 million. And when they're there, the hospital tells them, look, your condition needs another 1 million. They don't have the money. They don't know where the money will come from. Because most of the patients who go there, how they raise their money is through Harambes, selling their properties or friends and contributions. Rarely are they going to go there because insurance is paying for them. Most of them have to fundraise. And so it's not like they have a reservoir of money that is awaiting for them, or they don't have any surplus. Most of them have the exact amount that they were informed by the brokers who, connected them to those hospitals. So I met quite a number of them who were stuck there because they were misinformed. They were taken to very expensive hospitals, because we also met other patients who were in other hospitals, because in New Delhi there are so many hospitals. So Kenyans somehow connect with each other when they're there. And one of the patients, actually, I remember, was stuck there for like 3 months because they couldn't afford to pay for their hospital bills. They had escalated to very high levels, and they were not even having somewhere to sleep. They were not having food. They were now being thrown out in the streets, only because they were misinformed. So I picked those kind of problems. They also talked to me about how it was difficult before getting to India, on the documents they needed, on how to get all the, knowing how to go about it. That also was a major problem that I picked. And, all those issues sort of birthed something in me. Because, I wasn't in much pain when I was going there. Of course, there was some pain and discomfort. But when I saw what others were going through, I was like, I'm not even sick. When I looked at what others were going through, cancer patients, patients who had broken legs and broken arms and ribs and backbones and all that, conditions that are so severe. For me, it's like I stopped worrying about myself and I started now taking care of these other patients.